And welcome to IHPME Research Day. I'd like to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of Indigenous people and remains home for Indigenous people across Turtle Island. We are grateful to have the opportunity to work on this land. Our students have put together an exciting program. This is a chance for us to get a taste of the innovative research and policy work being undertaken by our students, as well as a chance to celebrate achievement. I would like to congratulate our students for the choice of theme, climate change and sustainable health systems, and creating a space today where we can hear from and discuss these issues, hear from experts and discuss these issues amongst ourselves. It's gratifying that our emerging scholars and policymakers have not lost sight of and are keeping our attention focused on what is perhaps the most pressing issue of our time. Before I turn things over, a quick thank you to the GSU Research Day organizers, Shi Guan and Lillian Lee, the Research Day Organizing Committee, our graduate directors, Whitney Berta and Aviv Shashak, and the many people listed who've contributed and who are, as I said, listed in our program. With that, I'd like to introduce Professor Fiona Miller, who will be chairing our opening panel session.
Thanks very much, Audrey. I'm going to start by sharing my screen and just confirming that you can see this. So I'm very privileged to be given the opportunity to chair this panel discussion, which raises issues of vital importance to a unit such as HPME. We really exist as a university unit in order to support high quality, equitable, and socially accountable health systems. Therefore, we have an incredibly important role as a research and education and impact-driven unit to support health systems to mitigate the harms of their operation, to adapt to the climate crisis and other ecological challenges that are facing us and face our capacity to deliver vital care and serve the communities that we exist to support, and also to demonstrate the leadership that such a trusted social institution, such a trusted community of health professionals, health researchers, and so on. We hold that trust and we need to use it to advance these profoundly important social goods. We started this conversation in HPME about what role a unit like ours had in addressing the climate crisis about 4 years ago. And I can't tell you how incredibly delighted I am and how privileged I feel to have seen the leadership of our students as they have engaged this and embraced this and brought this forward. I did not think 4 years ago that the students would decide that we should dedicate a research day to these topics. So my many thanks to them for that. And I now want to thank our expert panel that I have the very great privilege to introduce to you today. I'm going to introduce our 4 expert speakers in turn in the order in which they will give their brief remarks, starting with Kent Waddington. It's extremely important and appropriate that we start with Kent, because Kent is from the Canadian Coalition of Green Healthcare, which is celebrating its 20th anniversary this year. The coalition is a national NGO. It works across the country, has done so very effectively for, as I say, 20 years to begin the profile of healthcare's environmental responsibility and to advance that profile over 2 decades. So thank you very much, Kent. Our next speaker is Quinn Grundy, a professor in the Faculty of Nursing at the University of Toronto and a real leader in terms of nursing leadership on environmentally sustainable care. She brings to us today her expertise in the commercial determinants of health, which affect every aspect of the ways in which our health systems operate, and therefore also influence their capacity to deliver socially and environmentally accountable care. Our third speaker today is Dr. Kimberly Wintemute, a family physician in the North York Family Health Team, a professor in the Department of Family and Community Medicine at the University of Toronto. Kimberly has played a significant leadership role in several capacities, driving quality improvement initiatives across primary care, and as the primary care lead for Choosing Wisely Canada. So the agenda for high quality, appropriate care. And it is really under those capacities that Kimberly is a leader for sustainable healthcare, bringing that same vision of quality improvement and appropriate care to the question of environmental sustainability. And our fourth speaker has a similar profile in some ways, but some different expertise. Edward Shee is an emergency physician, clinician investigator at University Health Network, and also a professor in the Department of Family and Community Medicine, where he is one of the leads for an initiative within DFCM on climate change and health. So many of our sister faculties and departments are similarly motivated and engaged. Edward has long been engaged on these questions of sustainability as a member of the board of the Canadian Association of Physicians for the Environment. And I think his program of research really is the broad remit of sustainability, those issues of social sustainability that speak to justice and equity, as well as ecological and planetary health. So that those are our four amazing speakers today. So I'm going to start, if I may, by asking Kent to start us off with a few remarks from the Canadian Coalition.
Thank you, Fiona. Good morning, everybody, and all the folks at U of T. Appreciate the opportunity to be here and share a little bit about the Canadian Coalition for Green Healthcare and the sorts of things we've been stirring up for the last 20 years. We're Canada's only not-for-profit green healthcare organization, working as a catalyst for environmental progress in the health sector. And over the time, the 20 years, we've engaged with literally hundreds of healthcare organizations and helped nurture, I'm going to say, thousands of individual green healthcare champions across the country. When we started the coalition 20 years ago, green was literally a paint color. Nobody was thinking about what's turned into this movement. So selfishly, we're happy to take some degree of credit for building the framework upon which Canada's green healthcare movement is based today. As Canada's premier integrated green healthcare resource network, our mission is to enable the healthcare sector to lead integration of environmentally responsible practices, resource conservation, pollution prevention, that sort of thing, into the actual delivery of compassionate care. We collaborate with healthcare organizations, facilities, professionals, government, NGOs, the private sector, and others to raise awareness of the issues and to increase the capacity of the health sector to address the environmental issues leading to a sustainable health system. And increasing an organization's capacity to integrate sustainability within their operations, strategies and policies can allow them to provide a better level of care to the communities and the populations they serve. Next slide, please, Fiona. So a listing of just the many areas of interest we have. We do research and we support those actively engaged in greening Canada's health sector. I'm not going to read these to you, they're right there. As funding opportunities present themselves and as a need is recognized, we will add to this growing list of interests and the depth of them. Recently, we've started to do work in the circular economy, and we've introduced resources on how the sector can more fully embrace electric vehicle technology and the infrastructure to support them as well. So those are two new ones that we've just recently added. And I encourage you to go to our website at greenhealthcare.ca. There's hundreds of resources there that you can download for free. Next slide, please, Leon. So in addition to case studies, discussion papers, research reports, the coalition has a number of additional tools to support those people working in sustainability within the sector. The most exciting one we have right now, and it's brand new, it's just launching, is called Health Share. It's sponsored by the coalition in partnership with an organization in the Netherlands, and it's a national online asset sharing platform for healthcare organizations and their suppliers. The initial focus of Health Share is on PPE suppliers and hospitals, but will be expanded over time. So right now it's free access for PPE suppliers during the pandemic. The Green Hospital Scorecard is the only comprehensive healthcare benchmarking tool in Canada that is measuring energy conservation, water conservation, waste management, recycling, corporate commitment, pollution prevention, and hospitals report using an online portal, and then they receive a scorecard for their success at the end. And the main purpose for the Green Hospital Scorecard is to provide a vehicle for standardized, sector-specific environmental benchmarking, and to connect hospitals with environmental information that will assist them achieving environmental and economic benefits. That includes reduced greenhouse gas emissions, improved energy, water, and waste efficiency. And we're finding year over year that a lot of C-suite and executive people, they're quite liking this because it shows them in an unbiased way we're making progress. Despite COVID, we've had 100 hospitals this year, I think a little over 100 hospitals this year take part in the 2019 call for data. And exciting for us is that we're currently working on a similar initiative for long-term care. So Fiona, we'll probably be keeping you up to date on that. In terms of climate change, we developed with the help of Environment Canada and Environment Nova Scotia, a 78-question self-assessment tool for supporting the document and supporting documents, that help healthcare organizations assess the anticipated risks to their organization or to their facilities, and highlight areas where they're excelling, and highlight areas as well where maybe they need a little bit of improvement. The Energy Light Energy Management Program, it's a new 3-day, 14-module online training that was delivered by 3 of Canada's, we like to say, their brightest energy management minds in healthcare. And it was tailored specifically for healthcare buildings and audiences. And the first cohort was done in October. What I hope many of you will be interested in signing up for is our free green digest. And it's filled with stories about greening healthcare in the Canadian sector, as well as success stories internationally. It has information on when we learn about funding and training opportunities, updates on the coalition, and launch of any coalition research and publications that might be there. So just, feel free to reach out to the coalition in general, to myself or any of our team, if you'd like to either learn more about what we're doing to try and make Canada's healthcare system more sustainable, or if you'd like to engage with us in any way.
Thanks so much, Kent. Great. Quinn.
Hi, everyone. Thanks for this opportunity. So on this slide here, you're going to see a lot of logos, and these are some of the original Fortune 500 companies. And I'm going to argue in the next 5 minutes that we need to pay particular attention to the activities of corporations and, more broadly, what I call the commercial determinants of health. think some of the other panelists will speak to other social, political determinants of health. And Kent has really nicely outlined many of the activities that his coalition has with healthcare leaders. But I think when discussing and visioning sustainable health systems, we have to also think about these external commercial stakeholders. So for example, the manufacturers of drug and device companies, the activities of corporations and how they impact environmental health through pollution and other practices, food and beverage companies, food systems. And I think all of this, if you start to imagine, has some powerful links with healthcare. Public health researchers have really pioneered the study of corporate influences on health. And I want to present this as a particular lens that we can bring to research, but also to practices and certainly decision-making processes. And this lens really is the idea that corporations, regardless of the product they sell, have a set of activities or practices in common, things like advertising, lobbying, political participation, public relations, litigation, funding and dissemination of scientific research, and that we can actually systematically examine these and strategically challenge them where appropriate to achieve our population health goals and also sustainability goals. So can I have the next slide, Fiona? So I think there are three main levels that we could focus such a lens in our initiatives around sustainable healthcare. So the first, I think, is a focus on ensuring independence in clinical decision-making. So clinicians interact with pharmaceutical, medical device, and other medically related companies often on a day-to-day basis. Many of these interactions, such as attending a company-sponsored education event, are highly associated with gifts such as food or beverages. In an Australian study we conducted, we found that over 95% of education events sponsored by pharmaceutical companies for clinicians had food at the event. Many other clinicians also receive payments from company for attending meetings, travel sponsorships, speaking fees, advisory boards, consulting. And while I think it is highly important that we maintain interactions with these industries, particularly around providing feedback on the design of devices, packaging, their use, I think it's really important that we start to question and find ways to ensure independence. We know that these sorts of payments and gifts are associated with increased prescribing, increased use of devices, and that this is a key challenge for sustainable health systems. Dr. Wintemute is going to speak next, and we'll talk a little bit more about the challenges around low-value care and how we can start to ensure that the care we do deliver, the products we do use, are the most effective for that particular case. Next slide, Fiona, please. We also know that industry representatives from manufacturers are really integrated into the day-to-day functioning of a hospital. For example, every time hospitals purchase a product, they are often contracting with industry reps to provide the education on that product. This creates some distorted incentives because obviously the company is interested in promoting the use of these products as much as possible and increasing the levels at which those products are stocked. And so when we apply a sustainability lens to some of these interactions, we're not actually promoting the judicious use of products, and I think can identify areas potentially of waste. We also know that hospitals outsource a lot of things, such as laundry, housekeeping, cleaning, food services. And I think it is time to apply a commercial determinants of health to these sorts of arrangements as well. So while it may appear to save costs up front, we have research that shows that a lot of not only the health impacts, so for example, when they have contracted out cleaning, we saw a rise in hospital-acquired infections. We also see socioeconomic impacts on people who are then paid less or given less job security. But we've yet to really question, I think, the environmental impacts. And I think we need to start applying a sustainability lens and a lens that examines corporate influences on health to these contracting arrangements. Next slide, Fiona. And finally, I think we need to start thinking in terms of sustainable models of care. And while these are obviously complex, multifaceted, there is a commercial determinant of health and economic incentives that need to be accounted for. So we know that pharmaceutical and medical device companies, they wield immense influence over evidence-based practice, whether that is through sponsorship of research, through involvement or sponsorship of clinical practice guidelines. And what we've seen is that a widening definition of disease, lower thresholds for diagnoses, and a very intervention-focused medical care. I think we need to consider, again, independence in evidence-based practice as a whole, and also sustainable models of care that take these commercial determinants of health into account. I am here from the Faculty of Nursing, so I would put in a plug, for example, for nurse-led models of care, which often occur in the community, home settings, is preventative, cost-effective, and also associated then with fewer interventions, tests, and procedures. So this, I think, is a nice segue into our next speaker. I will leave it there.
Thanks so much, Quinn. Yes, Kimberly.
Okay, good morning, everyone. So I have been one of the clinical leads at Choosing Wisely Canada since 2015. The Canadian campaign started in 2014. Choosing Wisely itself was born in the Obama era in 2012 in the US. And it was really a call to arms, for clinicians who had kind of abandoned their sense of, their professional responsibility around cost and around do no harm as their guiding principle. So Choosing Wisely Canada is a campaign that encourages conversations between clinicians and patients to reduce unnecessary tests and treatments. And as you'll see from this slide, which is, the image is disturbing at the best of times, but perhaps more so at 9-something in the morning, the more is not always better messaging has been one of our core themes. And I think it's this theme that kind of cross cuts with the issue of sustainability in healthcare, and is perhaps one of the reasons why the Choosing Wisely campaign is often quoted or referenced within the community of people interested in sustainable healthcare. Choosing Wisely exists in 21 countries around the globe. So each of them have a campaign that is somewhat unique, but also, has similarities. And it's been well established by first the Institute of Medicine in the US, and then more recently CIHI in Canada, that about 30% of what we do in healthcare is unnecessary. And by unnecessary, we mean it lacks an evidence base for any degree of effectiveness, and or things are happening that are known to be more harm than good. And so the Choosing Wisely campaign, if you went to our website, you would see that there are lists of recommendations that are put forward by a variety of clinical societies. So, for example, the College of Family Physicians of Canada has a list. The Canadian Group of Pharmacists, they have a list. Canadian Society for Internal Medicine, the Geriatric Society, the Psychiatry Society, etc. And these societies, we solicited from them. We said, tell us 5 or 10 things that go on in your specialty that lack an evidence base or are known to be causing more harm than good, and tell us what those are, and let's call out to people to stop these actions or reduce these actions. So there is no list per se for environmental sustainability, but just there is definitely there are cross-cutting themes between the Choosing Wisely Canada campaign and the sustainability effort. Next slide, please. So one of the things that I've been involved in very much so is quality improvement at the primary care level and within primary healthcare teams. So this just showing that kind of simple arc of plan, do, study, act, and that most essential methodology that's used in quality improvement. So from 2016 to 2018, working in my kind of choosing wisely capacity, I led a large quality improvement effort across 6 family health teams in Ontario, where we endeavored to implement Choosing Wisely Canada recommendations and over a population of 183,000 patients. And we focused on a few key areas. We focused on prescribing or rather de-prescribing some medications that are known to be more harm than good. And then we also focused on inappropriate lab testing. And really the de-prescribing piece, we had significant wins in that area. And so we were able to kind of shift prescribing patterns in some key areas that had to do not only with personal health for people, but also with societal health. So, one of the focus areas was on sleeping pills in older people who are 65 or older, which are known to be to be associated, for example, with increased rates of car accidents. So there's a social problem as well as a personal problem for people. And so could I have a click on the slide, please? So with that kind of lens and with that kind of success that we've had in the past, one of the things that we're working on now is the possibility that we could achieve some similar successes around metered dose inhaler prescribing in primary care, and in fact across other health faculties, not just within the Faculty of Medicine. But we know that the metered dose inhaler, so that that kind of classic inhaler that you see people kind of puffing away, and we know that the propellant in that inhaler is a potent greenhouse gas. And we also know that many people who are using that kind of inhaler either don't have a formal diagnosis of an airways disease to justify its use, or are using the inhaler incorrectly and in fact not getting the medication from the inhaler, or could be prescribed a more suitable inhaler, a dry powder inhaler that would be more environmentally friendly by a long shot. So we're looking at ways within the Department of Family and Community Medicine to kind of roll out potential quality improvement. And we're also looking at, kind of educational efforts and messaging efforts across all of the health faculties around metered dose inhaler use. So with that, I will turn it over to our next speaker.
Thanks so much, Kimberly. So I'm going to stop share and invite Edward to share his screen so that he can control his. Thank you, Edward. Over to you.
Great. Thank you very much. Let me see if I can get this going. So the question that we have here today is what are the challenges and opportunities in moving towards sustainable health systems? And I think one of the key opportunities for me is being able to consider and pursue forms of knowledge that will help us to tackle the current situation of climate change. And so for me, I think of the health problems posed by climate change as an issue of justice. And this is where I get into these social and political determinants of health that Quinn had mentioned before. And so this is a map of a global map of vulnerability to climate change, where darker red is indicating greater danger. And Canada, on average, at least according to this index, is one of the least vulnerable in the world, even though we're the 6th largest importer of food in the world, and even though we rely on other countries for our medicines, for freedom from conflict, and for new ideas and new citizens. Sadly, though, if I were to show you a map of who's producing greenhouse gases, we're also, as a country, one of the top polluters of the world. So it would actually look the opposite of this map. And that discrepancy is a major issue of injustice. Now, the ideas around justice form the basis for what we owe each other and what a government owes its citizens. And the most obvious example now is obviously COVID-19, and I'm sure we're all aware that COVID-19 is exposing inequities in health and its determinants. And incredible work on this has been done by our colleagues at U of T. And what particularly stood out to me was a statement that Professor Arjun Siddiqui delivered to the House Standing Committee on Health on this subject. And so I'll just paraphrase what she said by saying that Canada is structured in a way that has placed the burden of risk for COVID-19 squarely on the shoulders and in the lungs of marginalized and racialized peoples. And I'm sure it won't have escaped you how well the last two maps have overlapped onto each other. In here, this is from the Ontario Marginalization Index produced by the Centre for Urban Health Solutions. And again, darker green here indicates greater levels of marginalization. Now, Dr. Siddiqui presented her evidence on July 7th. And on that day, the temperature in Toronto rose to over 34 degrees Celsius. And in fact, July 7th was one of a string of 9 days where the temperature was over 30 degrees Celsius. And if we look at how rising temperatures affect people, it's not just in the global context, but also in our neighborhoods where those inequities lie. And this is from a map produced by Toronto Public Health. I think it would then also be accurate to say that Canada is structured in a way that has placed the burden of climate change squarely on the shoulders and in the lungs of marginalized and racialized people. And we can see that there are intersections between COVID-19, climate change, and societal systems. We know also that there are zoonotic origins and ecological contributions to pandemics. Which is why we can't separate environmental sustainability from our concerns about health and the integrity and good functioning of our health systems. This is from the Ottawa Charter, which I'd completely forgotten about it, and Fiona reminded me about a year ago. And I think it was prescient in emphasizing this nearly 40 years ago when it was produced, which is really quite amazing. And Ilona Kickbush, who was one of the major instigators of this, recently spoke about how proud she was that this red circle can still anticipate our greatest challenges for healthy public policy. And the Charter recognized that we don't have healthy lives without healthy environments. It also foregrounds that health is not just what we can achieve within health care, but instead it's what that we strive towards well-being in all aspects of lives, and it encompasses capabilities to thrive in the world. And so to conclude, I think one of the central opportunities we have is to renew our vision of what health means and to restore the place of supportive environments in systems to improve health. Thank you very much.
Thank you so much, Edward. So I think we now turn to the panel discussion. Thank you all of the speakers. That was wonderful. That was a fabulous overview of the range of issues before us. And I have a few questions to ask of the panel that I'm going to start with, but I see that Audrey already has a question. Do you want to start, Audrey? Shall I give you, as the director of the Institute, shall I hand this to you to start?
Oh, thank you so much. And thank you for a superb panel so far. Just a wealth of thought-provoking ideas. I have a question about what you see as the role of government and whether you think any meaningful progress can be made without action at a pretty senior level of government. And I'll just give an example of the internal combustion engine. And we were told that there's no way we can get over the dependence on the internal combustion engine. And today we have major car makers that are producing electric cars, and indeed all the traditional car makers have now transitioned to making hybrid and electronic vehicles. But that didn't happen without sort of regulatory structures. And I believe the EU has just passed a tax, which will take effect Jan 1 on packaging. And it's based on the weight of non-recyclable materials that are part of the packaging. And I'm just wondering, and that's not specific to healthcare. That's kind of broadly across all products. And of course, medical products, by necessity to keep them clean and sterile and whatnot, have a lot of packaging. So I'm wondering if the panelists might comment on how they see the government playing a role, a similar kind of role in the Canadian context.
I'm happy to weigh in as a clinician who works really at the micro level most of the time, and sometimes has an opportunity to work maybe at the meso level by virtue of things like quality improvement, but rarely has the opportunity to work at the macro level, which is, I think, where we have the largest levers. And I think that is certainly something that we need to be doing. We need to be influencing policymakers and legislation in order to make significant change that will be measurably larger by orders of magnitude.
Thank you.
Muted. Sorry, any other comments on that from our panelists, or shall I pepper you with my questions? Edward.
Yeah, I would love to tackle this question. So thank you so much for the question. I think this is very timely because, at least in Ontario and for the federal government, there are pieces of legislation that are up for debate now on these issues. And I think what I take inspiration from here and as an opportunity for our governments is looking to what the UK has done. So the UK NHS, their health system has made great strides in reducing their environmental impact. And they are fortunate to have major pieces of, or major mandates that we don't have in Canada. So for example, they have a government accountability framework that the NHS takes part of, which includes 5-year stepped carbon budgets. They have a clear long-term vision from the government, and there are targets that are set 12 years ahead. They have proactive communication to stakeholders, and they have capacity building to achieve these targets. They actually have their own unit within the health system that's focused on, you know, developing the strategies to do this. And you know, I think I'm hopeful that our governments will take on some of these lessons and actually improve upon them as well. And I really like this, you know, the example of looking at electric cars, because that actually speaks to some of the work that's been done in health systems around life cycle analysis of looking at, you know, even though we are switching to electric, what is the impact of that? They're often called zero emission vehicles, but if we are examining them within a life cycle analysis and looking at our carbon budgets, are they actually the best way of moving forward?
Terrific, thank you. We have another question from the floor, but I wonder if I may take the privilege of the chair and ask a few questions that that we thought would be useful to sort of discuss and debate. But I'm going to inflect this with a question that my colleague Reza Dieber has put before us about some of the tensions that are inherent in our various ways of advancing health for the health system. But I wonder, Kimberly, if you would like to start us off about how, because you're just saying you often work at the micro level, sometimes at the meso level. How do you find that environmental sustainability is being incorporated into your own work?
Yeah, so I guess via a slow and steady infiltration more than anything else. So in my clinical practice, in our family medicine office, for example, we started maybe about 5 years ago by doing simple things like changing our ordering patterns. We have a monthly office meeting, and in which during which the staff, you know, order lunch to be delivered, and we started looking at, you know, why are we ordering bottles of water and cans of drinks. It turned out that someone in our office thought that the water was unsafe to drink in our office building. So we were able to actually have that tested and assure everyone that the water was safe. So we went on to be more deliberate about our ordering, and that went on to create some excitement around, who do we order from? We're no longer ordering from places that involve black plastic. And have recently boiled it down to burritos or pizza because the because the packaging is minimal and oftentimes compostable. One of the other areas, I ride my bike to work, and I on most days, and I park it strategically, so in my office, so that patients can see my bike, and that generates conversation about active transportation and the benefits to the climate and the benefits to personal health. And then, in work with patients, one of the things we do as family physicians is we often encourage people around, healthy lifestyle. And so I would say, that I've started to encourage patients more around positive changes that they are making, and making the links with climate change and bringing that more into the conversation. I guess during COVID in particular, one of the other ways is to kind of permit and encourage the use of virtual care. So that's been a big change. And then choice of medications, for example, such as puffers. In Canada, another tool that we have is the Air Quality Health Index, which has an app which can be put on one's smartphone. So we encourage our patients to use the app and to get a push notification from AQHI when air quality is beyond a certain threshold. So we encourage asthmatic patients, people with chronic obstructive lung disease, to use those and to think about also their role in their own personal kind of contributions to, for example, air pollution, and how they can help with that problem.
Thank you. Edward, do you have a view on this that you'd like to share with us about how this is incorporated into your work, perhaps in your role with the DFCM?
Yeah, sure. I'll just share briefly to follow on Kimberly. So in my clinical work, it's been very challenging, as anyone who works in implementation science and behavioral sciences knows. It's very hard to change these things, especially since I have all these other competing priorities of sick patients. And so a lot of this has gone over to my administrative role with the Department of Family Medicine, where I am one of the co-leads with Samantha Green on climate change and health. And what we've started to do is try to put together some of the tools and resources that are out there. So we're hoping to update and include various aspects of what Kimberly's talked about in a Green Office toolkit in terms of operational, clinical, and practice considerations. Obviously, encouraging people to perform resource stewardship and rational prescribing, as Kimberly mentioned, and also one of our major efforts has been including sustainability within education competencies.
Thank you. Maybe I can ask a question about the strategies that are going to help us to move this forward. What are the strategies that are most promising? What are some of the main barriers? I mean, I don't want to seed the field too much, but this tension between infection prevention and control, environmental sustainability, not always they're in conflict, but sometimes they can be, might be one of the issues you identify, but I don't know. Kent, do you have views on what are the strategies we need to push forward?
So I guess the first strategy we'd suggest is that leadership needs to recognize three things here: links between health and the environment, between climate change and health facility resiliency, and quality of care and sustainability. We also need leaders to put funding and people in place to address the environmental issues that are facing their organizations and and their facilities. So we need them to build strong partnerships and alliances with other organizations, suppliers to address the priority concerns of their organization, the community they serve, even the region. And so establishing a clear plan with targets and measuring progress towards those targets is also very important. They can build on quality and risk management activities that are already in place, and then start to change the processes and the practices to be more sustainable. So recognizing the important role that health professionals and their institutions can play as advocates for health and the environment can have tremendous impact on the communities, not only the organization, but the communities. And often those communities are quite large, quite far reaching.
So Quinn, I'm gonna, given in the interest of time, I might actually ask you whether you tackle this issue, whether you want to work into this, your thoughts on COVID-19, which on the one hand is, I've seen people characterize this as a window of opportunity for change. On the other hand, it's quite possibly the worst time to advance these agendas. So I don't know, perhaps there's a nexus of issues there around strategies for change that account for where we find ourselves.
Yeah, and I think I'll try and weave in also this thread around the tension between the infection control as well. So I think one of the most viable or promising avenues I see is that we need to mobilize nurses. This is the largest proportion of health professionals, particularly in the acute care sector. Nurses literally touch nearly all waste streams. And yet, I think the main barrier here is that we still do not see nurses as decision makers. And I'm using that term very inclusively, people who are doing care work, personal support workers, frontline nurses. And I think that is so plain during this COVID-19 pandemic. We still do not have medical cures for COVID. People survive COVID because of public health and nursing care. And yet we're not seeing their views represented in the media. We're not looking to nurses for leadership on this. And on the floor, what I'm hearing from nurses who are, sitting in my classrooms, COVID-19 has put a real spotlight on waste, which I think creates a really interesting opportunity. It's also put a real spotlight on infection control. But nurses are one of the few professionals who are not actually given control over the tools with which they work. Hospitals tend to be very top-down in terms of procurement. Nurses know when products fail. Nurses are the ones who are living at that intersection of infection control and infection risk. Now, it's the nurse who takes the tray into the room. It's the nurse who goes in to do the care. The doctor is sometimes trying to minimize the amount of time spent in the room, rightly so. The visitors are no longer there. Nurses are filling that space. But nobody's really asked the nurses, how do we reorganize the delivery of care? How do we reorganize these physical spaces that they are practicing within? Often in an event, like an effort to standardize practices, manufacturers build kits for procedures. Well, the nurses know they open a sterile kit, throw out half the stuff, go get the rest of the stuff they'd like, and yet the hospital still keeps purchasing kits. Nurses know what gets wasted. Nurses also have a very tense relationship with procurement because they're known as hoarders, because they don't have the time they need to do the care they need to do. So you take everything with you into that room, and there's piles of stuff at the bedside because you don't have the time to go back. And often stocking is done with these, lean principles, and nurses weren't at that table. So we need to recognize the expertise of frontline clinicians at the bedside who are touching all this stuff and know very well how to manage infection risks, how to manage these waste things. And as I think, Edward, and to echo that, to build this into more of our education.
Fabulous, thank you. Kimberly, did you want to speak to this COVID-19 situation? Do you see this as a potential?
Yeah, you know, I have to say at the COVID assessment clinic where I work, I'm always just mortified by the garbage can full of gloves at the end of the shift, and I'm convinced that in several 100,000 years, one of the new layers of the Earth's crust will be made up of gloves and then surgical masks. PPE. So definitely COVID-19 has, you know, increased waste. On the other hand, I think it has done some things that are kind of more positive, sorry. For example, we've seen a real increase in the use of virtual care, which we know has benefit to the planet. An increase in the speed of kind of research and publication, an increase in intellectual sharing. Those are all positive things. And certainly COVID has provided a demonstration of how quickly we can shift on an issue if we decide that we want to. And I guess the big question here is, because the climate moves at a much slower pace than COVID, can we mobilize in common cause fast enough for the climate?
Thank you. So given that, in our role as health professionals, as healthcare researchers, future healthcare leaders, what would you say it is our role to play as individuals, as a community? You know, what's the phrase, by next Tuesday, that we need to start working on this? Edward, do you want to start us off on that?
Yeah, sure. You know, I feel like I'm going to rehash some of my answers from before, so I'll skip the clinician aspect of it. But I think as healthcare researchers, it really involves asking the questions and generating the evidence that can inform decisions about health system sustainability. And as you'll hear from our keynote speaker later, and from a lot of the student projects, and certainly as leaders, it's incumbent on us to recognize the evidence and also anticipate the direction of travel. And so I talked about the Ottawa Charter. You know, it's still relevant today. It was a massive achievement, and it's up to leaders to prioritize those goals and motivate and empower health professionals and researchers to achieve them. And actually, to follow on, you know, Kimberly and Quinn's point, and to address Reza's question, I think that, you know, I think it's important that there's policy orientation towards upstream prevention of these issues. And it's very, you know, when we talk about infection control, it's very similar for COVID-19 as it is for antimicrobial resistance. There are links with ecological systems. So for example, for AMR, you know, the vast majority of antibiotics are used in agriculture and not on humans. And so once we get to the hospital level, it is very difficult to prevent use of those single-use items. It would be great if we actually kept people out of hospital in the first place, is what I see. And I think having those community level, system level goals will help to achieve that.
Thank you. Kent, did you have a thought on this issue?
Well, I think it's important to remember that sort of informal leaders are just as important as formal leaders when you start talking about what are the options out there. And since a lot of these formal leaders operate with constraints and corporate structure, informal leaders can often get things done that the formal leaders can't. So it's important that you understand as you know, young healthcare leaders, the difference between your sphere of concern and your sphere of influence. And I guess I'd say start small within your work area. And I think it was Kimberly referenced what she's trying to do just in her own room alone. So regardless of what stream of health service research or, you know, clinical you're in, identify these actionable ways to incorporate sustainability into the daily practice, the conversations, the strategies. Try to make sure those discussions are on on agendas as frequently as possible and as high upstream as you can get them. So I guess it's really get your own house or office in order first, and do something that makes a difference, and then help spread that. And understand who are the influencers, both formal and informal, and who you need to connect with or suck up to, as the case may be, to overcome the inertia and build the momentum. I'd also engage you or encourage you to engage with older colleagues that may be somewhat set in their ways, and invite them to some new thinking, such as the circular economy, and try to root your actions in national or global framework. And selfishly, a plug for the coalition here and our membership with us, the Green Hospital Scorecard, but also the United Nations Sustainable Development Goals. Try to figure out how can we address those, whether it's making the cities and human settlements more inclusive and safe, or action against climate change. But continually advocate for sustainability, regardless of the team you're on or the environment in which you work. But don't be afraid to acknowledge the fact you're going to get pushback. And I guess make this your brand to, people see you and they know, yep, that's the environmental lady or doctor or whatever it is. And don't forget that mobilizing groups has a lot of power. I mean, look at Greta Thunberg, what she did. So be repetitious, make sounds, and figure out that the current situation you're in and how to make it better. And again, we've got some resources for that, and we want to engage with you.
Super. Thank you, Ken. I think, Quinn, that I kind of cut you off at one point, so I'm going to give you the last word before I wrap us up. Did you have some thoughts on this issue?
Yeah, I think I'll echo Kent to say I think there is such power in this political moment in kind of mobilizing this grassroots. I mean, the world literally broke this year, and in some ways that creates an opportunity. And I think one of the biggest challenges for sustainable movements is that there's a lot of desire, I think, to kind of continue business as usual, and a strong belief or assumption that we can kind of invent or innovate our way out of it. So to circle all the way back, I'm thinking about, I'm from Alberta. There's, I think, an electric F-150 truck coming, right? And I think if we're stuck in that place where we can just kind of invent new technical fixes to this problem, we're at a moment where I think we can collectively recognize that we actually have to do things in a fundamentally different way. And in healthcare, that'll be the way we provide care, the way we think about health, and I think the way we make decisions and enact that care. So mobilizing the people at the front lines, in the grassroots, our students, and I think we could see some really exciting initiatives.
Thank you very much. And so with that, I think that's a great reminder to all of us here in the entire IHPME community and our colleagues across other faculties and departments and other universities and other institutions of the role we have to play in advancing this agenda and investigating it and interrogating it and thinking about the tensions and the challenges, working from the macro through to the micro and everything in between. So I would like to ask you to join me in thanking our panelists for helping us to think through these challenging issues today. Thank you very much. I believe I was to say that the next session is in an hour. She or Lillian will jump in now to make sure I've got that right.
Yes, that's exactly it.
Fabulous. Thank you all very much. Thank you again to the students for organizing all this. Take care.
Thank you.
Take care, everybody. Have a successful day.
Thanks.
Thanks so much.